The Ottawa Minimally Invasive Gynecology Group, University of Ottawa presents Ultrasound in the Diagnosis of Endometriosis. The objectives of the video are to review the proposed levels of ultrasound in the diagnosis of endometriosis, to demonstrate our technique of ultrasound specifically performed for endometriosis, as well as to demonstrate the various level 1 and level 2 markers for diagnosis on ultrasound. In this section, we discuss the proposed levels of ultrasound. Level 1 ultrasound is performed as a general gynae ultrasound when clinically indicated to specifically look for soft markers of endometriosis. These markers include the assessment of uterus for uterine position, mobility as determined by sliding sign, and adenomyosis that is often seen in conjunction with endometriosis. Ovarian assessment should include mobility, tethering due to underlying adhesions, and presence of ovarian endometrioma. Pouch of Douglas should also be assessed for adhesions or obliteration, and sliding sign is a useful marker for the same. If the level 1 scan findings are indicative of endometriosis, and if clinically indicated, then a level 2 scan is performed. In addition to the markers scanned at level 1, level 2 ultrasound involves assessment of bladder, vagina, uterosacral ligaments, and bowel to look for endometriotic nodules or plaques. It is also important to assess kidneys and ureter for hydroureteronephrosis, as ureteral involvement is often silent and may present as renal failure. When a level 2 scan is positive for disease involvement, a more advanced imaging is usually performed by an expert radiologist in the field of endometriosis. This provides us with a detailed assessment of lesions in terms of size, site, depth of infiltration, distance from anus or trigone that helps a surgeon in preoperative planning. We will now discuss the technique of ultrasound. This usually includes infiltration of 10 to 20 milliliters of ultrasound gel in the posterior vaginal fornix. The transvaginal probe is then introduced and directed posteriorly to trace the rectum, anorectal verge, and linear aspect of bowel. The gel in vagina also helps to better delineate the anterior and posterior vaginal cuff as well as fornices to look for pathology in comparison to imaging without gel. The uterus is then assessed for its position, findings of adenomyosis, as well as its mobility on sliding sign. The sliding sign is assessed by manipulating the uterus between a hand placed on the abdomen and ultrasound probe. Pressure on the probe tends to slide the uterus off the peritoneum in absence of any adhesions. This is followed by moving the probe to each side to assess the ovaries for endometriomas. Probe pressure is also applied to look for ovarian mobility from uterus as well as pelvic side wall. The probe is then directed anteriorly to assess the bladder. Lastly, bilateral kidneys are assessed for hydronephrosis using a transabdominal probe. In this section, we will review some of the markers of endometriosis on ultrasound. Here we see an acutely retroflexed uterus that can be a sign of underlying adhesions. Inability to slide the uterus over the anterior as well as posterior peritoneum demonstrates a negative sliding sign. This again suggests adhesions due to underlying endometriosis causing obliteration of the cul-de-sac posteriorly and vesicouterine recess anteriorly. Ovarian imaging can commonly reveal ovarian endometriomas and sometimes can show both ovaries tethered to the back of the uterus, known as kissing ovaries. Pressure applied by probe shows a negative ovarian sliding sign, suggesting ovarian adhesions. When uterine and ovarian markers are seen, a level 2 ultrasound should image other organs to look for endometriotic involvement. Here we see an endometriotic nodule appearing as a hypoechoic lesion involving the anterior wall of rectosigmoid. A similar hypoechoic endometriotic lesion is seen involving the posterior vaginal fornix. Anteriorly, endometriotic nodules can be seen involving the full thickness of bladder wall, including mucosa. In summary, ultrasound is a simple and an effective modality to diagnose endometriosis, and an advanced level of ultrasound increases the likelihood of detecting endometriosis especially the deep form involving organs other than ovaries and uterus. Thank you.